if you'd like to take it from here.
Okay. Follow your skill sheet. Find out where I make mistakes. We'll talk about it at the end. If that makes sense, just kind of follow along. I have mine here just in case down the front of the block, a lot of memory. So be a little gentle with me, but again, critique me, see what I can do. Sometimes it helps if you watch someone and you see the mistakes that they made. Hopefully you won't make those mistakes again, if that makes sense. So, okay, you want to give them what you're going to give me, the first scenario.
All right, so basically, Kevin here is alone at the firehouse. Everyone's out on another call. It's a nice, hot summer and sunny day, mid-August, like mid-afternoon. I enter. I'm a 17-year-old girl who's just come from the park up the street. I've got my boyfriend with me. I am absolutely freaking out because I got stung by a bee. So, oh my God, you gotta help me, you gotta help me.
Are you scene safe? Okay, mechanism, injury, nature of illness. Actually, this is my only patient.
This is your only patient.
Okay, nature of illness appears to be a possible bee sting. I don't know that determination yet, but we're just going out from the information. I'm going to call for ALS support. Is there any reason for spinal percussions at this time?
No spinal percussions.
General impression of this patient would be poor based on her mental conditions, kind of a little bit agitated at this point.
I'm totally freaking out.
Okay, I'm going to go ahead and determine her level of consciousness. My name is Kevin. I'm EMT. What seems to be the problem today?
Oh my God, my boyfriend and I were at the park, and we were just having lunch, and I got stung by a bee, and my dad, he's really allergic to bees. Last summer, he was in the hospital, and they put all these tubes in him, and oh my God, am I going to die?
Okay. I don't think so at this time. Okay, just, if you can, just relax a little bit, try to control your breathing, and we'll see what we can do for you. Okay, general impression, obviously poor, alert, but maybe a little bit of an altered mental status, maybe have an allergic reaction. We're going to investigate that a little bit further. First thing I'm going to do is look at her airway. I'm assuming that it's open and patent, but she's talking, so I'll ask, can I go ahead and look at your mouth to see if we have anything going on in here? Okay, so I don't see anything. I don't see any tongue swelling at this time.
No.
Okay, I'm going to go ahead and assess breathing, and the way we assess breathing, of course, listening to the lungs, all four fields, observing for chest rise, and counting. So what are my, do I have equal bilateral chest rise?
Equal
what is
bilateral.
the rate, rhythm, and quality of my breathing?
Equal bilateral and 23 and strong.
Okay, 23 and strong, okay? So at this time, we're going to go ahead and assess circulation. So I'm going to check for condition of the skin. I'm going to look over the general impression of the skin. What is my skin color, temperature, and condition?
Hot, red, and diaphoretic.
Okay, hot, red, and sweaty. Do I have any major bleeding at this time?
No major bleed.
No major bleeding. And pulses?
Pulse is 98 and strong.
Okay, 98 and strong. All right. So I don't have the ability to transport from the fire station, so we're going to make this person a high priority for transport based on the condition right at this point, and we'll determine that as we further go along down the way. All right, so at this time, I'm going to jump into either a focus or a detailed physical assessment. I'm going to probably start with just a focus at this time. Okay. Probably going to be a allergic reaction is kind of what my mind is thinking, but again, we're going to look a little bit differently. So, you say you were stung by a bee, right?
Yeah, right there. I'm also wearing flip-flops, shorts, and a tank top.
Okay, so I'm going to go ahead and have you have a sit down here. All right, so I'm going to go ahead and look at this. Okay, I see you have a bee sting in here. You said your father's allergic to bees. Are you allergic to bee stings?
I don't know. I've never been stung before, but I'm really, really scared. He almost died.
Okay, so we're going to keep working on that. Okay, I have the stinger there. Pull out a credit card or whatever, remove the stinger at this point. Okay, and how long ago did this happen?
I don't know. It took us a few minutes to walk up here. It must have been like 10, 15 minutes ago. I don't know. Why are you asking me all these questions? Why aren't you helping me?
We're going to help you in just a second. I got to determine what I need to do for you to make sure I give you the right treatments and things that are going on with it. Have you done anything to help this? Have you taken anything?
No, I came to you.
Okay, and that's a good thing that you did. All right, and you haven't done anything, and it's gotten worse since we've been here?
Oh my God, I don't know. I'm freaking out. I don't know what's going on. It hurts, and I don't know. It's just I'm freaking out, and I'm gonna die. And you have to do something to help me right now. Where is everyone?
They're all out on call right now. You got stuck with me. I'm the only one here. So, all right. Are you allergic to any medications?
No,
Okay. Do you take any medications?
birth control.
Okay. Last time you ate or drank anything?
We were having a picnic in the park,
Okay.
so about half an hour ago, I guess.
Did you eat any? You're not allergic to any foods or anything like that?
No.
Okay, so it was nothing that you ate. It's obviously from the bee sting. All right. At this time, I'm going to go ahead and get a set of baseline vitals. So I'm going to go ahead and assess blood pressure. What's my blood pressure?
My blood pressure is 130/98.
Okay, so blood pressure is 130/98. Pulse, has that changed at all?
No, still same.
Okay, and pupils?
Pearl.
Skin is still pale, warm, and dry, or pale, warm, and sweaty?
Hot.
Hot, warm, and sweaty. Okay. I'm going to go ahead and get a blood sugar at this time. What is my blood glucose reading?
Blood glucose reading is 93.
Okay, so not an issue there. Breathing rate is still, what's my rate rhythm quality on that?
I am still huffing and puffing, but bilateral and strong
Okay.
to 23.
All right, so I'm going to go ahead and listen to the lungs again. Do I hear any wheezing or any abnormal sounds, breath sounds?
No.
Okay, so lungs are clear, no sounds at this time. All right, I'm going to go ahead and start you on some oxygen, and we'll put that on a 15 liters a minute non-rebreather mask. See how that, does she tolerate that, the non-rebreather mask?
Yeah.
Okay, so we'll go through that. We're going to go ahead and transport, based on protocols and written orders. Epinephrine is really not called for at this time because you're not showing the, you don't have any swelling, you're not having any trouble breathing, a lot of your agitation.
But am I going to die? Because really,
Yeah.
you don't know what happened to my dad. It was horrible.
And your dad probably is allergic to these things, which we know that. That doesn't mean that you are. We'll get you to the hospital, they'll check you out. We'll have to be there shortly, probably within 5 or 10 minutes. Once the ambulance gets here, we'll get you transported and they'll do a little further examination. But there's really nothing I can do for you right now. I'm going to give you the oxygen. If you can try to slow your breathing rate down a little bit, that will help you calm down, and that will lower some of your anxiety and help you deal with that, with the situation. So I understand you're scared, and that's okay to be scared, but it looks like you're not having an allergic reaction.
Are you sure?
I'm almost positive you're not having an allergic reaction. Like I said the oxygen is going to be the best thing for you at this time.
Because my dad will sue you.
And that's fine. If he wants to do that, that's fine. If there's a problem, we'll deal with that later. Let's get you squared away, get you to the hospital, and then we can press into that as we go on. So again, and while we're doing that, I'm going to go ahead and reassess vitals every 5 minutes. Kind of a judgment call whether it's a critical patient or not. Obviously, it's somewhat of a critical patient. Again, focused assessment, I'll look at the injury site where the bee sting was, see if I see any swelling, anything like that. Continue to monitor the lung sounds for wheezing, any signs of anaphylactic shock. If there is none, we'll just continue treating with oxygen and transport to the hospital in scene.
All right. So, questions?
Yeah, why did you administer oxygen like way after? Isn't that part of the airway and breathing?
Yes, and I probably should have done that first of all, so that was something that I missed, and I caught myself doing that later. Questionable whether that would have caused, I mean, her breathing rate was okay, but yes, but I should have administered oxygen probably first.
That's a good catch. What else are you looking for? What else is a good thing to be aware of when you're in your ABCs? Like, what's oxygen is a treatment for it, so it's a good time to think about what's the word I'm looking for, guys? Shock. So in your ABCs, once you've got oxygen on them, bam, just in case, I'm going to go ahead and throw a blanket on them. And that way I'm starting to treat for shock if she does go into shock. And that'll have that critical fail right out of the basket.
So
right
even
there.
though you're 23 and breathing strong, you're still gonna administer oxygen?
Yeah.
Like
Yep.
put non-rebreather on?
Yeah.
Everybody gets oxygen.
Everybody gets oxygen, and even if it's not something that's like medically,
If anything else, they'll chill them out.
necessary, it will chill them out. It'll make them feel like something is being done for them.
And as far as wrap a blanket on them if they're hot.
Oh, if Kevin had actually, okay,
What's your anaphylactic triad? Someone give me the anaphylactic triad.
Low blood pressure.
And ODP and.
Skin, that's what I'm looking for.
Yeah.
So she is hot, red, and sweaty. How are you going to tell that she's actually red and that's not her skin tone?
You're gonna ask her.
Capillary fill.
No, you're going to look. You're going to move her shirt. You're going to ask to move her shirt, and you're going to look at areas that she was not exposed to the environment, because you're going to be able to see if you have any kind of outbreaks or anything going on. Plus, you're actually going to be able to gauge what her baseline color is, see if she's actually having an environmental emergency or something like that. So, did that answer the question?
More or less, I just was wondering, maybe throwing a blanket on a treat for shock, but they're already burning up.
You know, even when you're pulling someone out of a hot environment, since their auto-regulatory system is off, you want to help regulate that.
Just like in trauma, do we need to verbalize exposing the chest, even if it is, let's say.
I do. Anytime I'm checking someone out, I'm going to inspect, auscultate, and palpate. You want to IPA the chest, and I mean, if that means that you're moving clothing in a respectful manner, you know, so that the world around can't see what's going on, then absolutely do it.
And when you guys, and that's the reason I didn't say, you know, okay, I'm listening for lung sounds. Actually do it. You know, check where you would, when you check for pulse, you know, make sure you're checking where, you know, I'm checking for pulse, or I'm checking for something like that.
Yeah.
Make sure you're actually doing it, because we need to see that you're performing it the right way.
Yeah, and that muscle memory can also save you if you forget to verbalize the steps when you're going through this. Like, if you've got the muscle memory to where you're going through and you're hitting your points, even if you don't say it and your proctor sees you do it, you're going to get checked off at that point. So, anyone else?
Is it time? No? Time?
We'll be timing you. Yes, it is. It's a 10-minute station, and we'll be timing you so that you know where your times are at. Don't worry so much. Get how long it takes you to get through it to begin with, and then just start whittling away at your time. But don't try to rush yourself through it and worry about the time right now. Make sure you hit all your steps and get those done.
The last 4 labs you guys do, if you look at your syllabus, it says all skills time, mock testing, then we'll kind of hold you to that time more so you can see if this had been my class final, I would have been over by 30 seconds or whatever. But yeah, don't worry, exactly.
Yeah.
Don't worry about it for now. It just kind of gives you a baseline of where you are and where you need to be. But
yeah, right now try to get like all your steps down and make sure you get all your points, because guaranteed you're not going to be you're ready to give up the seat as soon as we're like, all right, you're doing medical, give me your seat. You're going to be like, no! And that'll come really, really quick.